I grew up in humble beginnings. Don't ever think we had money or anything like that. What we had was a will to better myself and try to help the community from which I came from.
And at that time, we knew there were people, mostly older, who made the choice between food or medicine. And that was in the real world.
When new folks came to town, you couldn't find a primary care physician. When people who didn't have insurance were looking for a primary care physician, they couldn't find one. And dental, which is a whole nother subject, was just impossible for people to find.
Kids, we were driving them to get their teeth extracted, permanent teeth, and so children who were compromising the whole future because they didn't have basic health care in our area.
And his response to me was that he just needed someplace to go. And everybody just needs someplace to go. And that's what we need to be.
Well, the health center movement really started in the 60s. And I like to think of it as an experiment that really worked.
In Mound Bayou, Mississippi, and the Columbia Point neighborhood in Boston, doctors Jack Geiger and Count Gibson pushed forward a radical new idea. It would change the course of healthcare delivery, a community-based model of healthcare that was to serve all people, regardless of their ability to pay, and give patients a voice in how that care was delivered. Since then, for over 40 years, Missouri Community Health Centers have delivered basic health care to hundreds of communities in need. From humble beginnings in poor rural communities and inner cities, they have evolved into a vital safety net for the uninsured and vulnerable. But Missouri Health Centers did not always exist. And without few committed people and organizations, they might never have happened.
And we all got together and said we ought to write a grant and start a community health center in this area because the need was so great. And when they got funded, they said, why don't you come and run the place?
Someone had to do it. Someone had to become a community health center. We'd do whatever it took in order to get one started.
Well, obviously I knew nothing about running nothing. I knew how to be a nurse and I knew how to be, compassionate with people and understand their needs. But so I was learning as I took this job.
In the beginning of the Community Health Center, it required long, extensive hours. The executive director had to do everything. And I was promoted to the executive director for 15 years. So I would go out and do the advertising, I would do the recruiting, I would go out and solicit funds. I did everything possible to make that clinic a success.
Back during the old days, I had to literally write the grants, write the progress reports, and sometimes see that the billings went out on time. And a couple of times had to even close the books.
We've got to get a mammography machine, and I don't know where we're going to get $70,000. What do you think we should do? So I said, simple. You and I are going to write a check for $1,000, and all we got to do is find 69 more people to do the same. So he said, okay, you're in charge.
And People's Health Centers was a little free clinic, storefront on Kingsbury and De Pere here. It was in a two-family flat, and that's where it all started.
Equipment was old and had been retrieved from charitable donations of some kind or another. Jack used to say that the x-ray equipment came off the Mayflower. It was pretty old, but it worked. A copy machine was a big deal back then,
So that's how we actually started, was sitting around a table, okay, we've got one doc, we've got a couple hours on a Sunday afternoon, how can we staff it with volunteers? Where do we get the medical supplies? Where do we get the office supplies? That kind of thing. But it became clear that no matter how much good we were doing with that volunteer effort, it was only as good as the willingness of those doctors to volunteer their time, or until we wore them out and they were in their 70s and 80s at the point they were working with us.
Our patients come from throughout the world, which makes Samuel Rogers so special in the eyes of our community.
The driving passion that gets you going for community health centers has got to be getting to those people that otherwise are not going to go to the doctor. We're not out there competing to steal patients from one another. We're out there to compete for those patients, to get them in the door that otherwise just would go without health care. It's getting them off the street, motivated and kind of engaged in their own health care.
You know, it is imperative that we continue to advocate for these agencies that are providing outstanding services and care to the folks, as I said earlier, that need it most.
We do not discriminate based upon a patient's economic or social circumstances.
When I see my patients, I have a large portion that are basically hardworking Americans that their place of employment just doesn't provide them health insurance. And then what ends up happening, they have a minor illness, and because they have no access to health care, that can lead to them having lost wages, and certainly under worst case scenario, having disability due to that illness, that if they had just treated it appropriately initially, they would have avoided those bad outcomes.
While others are talking about healthcare and how to improve access to services, our community health centers have been doing it and have been doing it for 40 years. Well, technology certainly is the future of the way healthcare is going to be delivered throughout the country. And I believe that our community health centers in the state of Missouri are at the forefront of implementation of health information technology.
The best quality of care and provided in the most efficient, cost-effective manner is that each individual has their own physician. That physician knows your name, they know your health problems, they know the medications you're on. You have a one-on-one relationship with them. They're able to be a medical home.
Community health centers, by their nature and by the law, provide a more comprehensive set of services that include dental and mental health and social services and enabling services that are more complete than you normally find in the private industry.
So, for example, at Family Care Health Center, patients can come here, they can see me for their primary care, and right on staff in the same facility, we have a lactation consultant, we have a nutritionist, we have a dentist, we have our own pharmacy, we have a psychiatrist, and the list goes on in terms of support services that I can draw on in order to take care of my patients' needs.
So I really think that the next generation, the next moves for these community health centers is going to be in a way that takes that great foundation of top-notch medicine that the clinicians brought to community health centers. It's going to marry that with technology and consolidated information, and it's going to create an explosion of efficiency in the community health center movement.
We've got second and now third generations of families that are still coming to our institution to receive our services, which is a very warm feeling. I mean, we are the resource that they depend on to make it to the next day.
When the board honored Sam, with the renaming of this center, we had buttons that said, Dr. Rogers delivered me. We had 2,000 of them and ran out. And he was very, very proud of that.
In 1980, there was approximately 9 community health centers in the state of Missouri, and there was around 600 in the United States. Now there are thousands.
Well, I have to pinch myself because sometimes it's like we did it, but how did we do it?
I think that really sends a message to every one of us, that the importance of perseverance, the importance of dedication, and I think the importance of absolute respect for mankind will get us through.